Greetings, everyone. A warm welcome to this seminar on finance and trade lessons from the pandemic, a path forward. I'm offering a warm welcome on behalf of Deputy Director General Annabel Gonzalez. Unfortunately, Annabel's been called away because of very intensive negotiations here in Geneva. But it's a real privilege for us to welcome here in person, at least for us in Geneva, a greatly valued colleague, Ruchir Agarwal, who is head of the Global Health and Pandemic Response Task Force at the International Monetary Fund. It's particularly pleasurable to be able to welcome him to Geneva, because we have been working intensely with him and his colleagues remotely, though, over the last 12 months, in the context of the Multilateral Leaders Task Force, which I think has been one of the great developments in multilateral cooperation in addressing this dreadful scourge of the pandemic. Working together, we've learned a great deal, and indeed that collaboration has led to really valuable substantive and factual resources. We see these as indispensable tools for policymakers working on the complex interplay of trade, intellectual property, and public health issues that the pandemic has confronted us all with. A particular concrete example of this is the COVID-19 vaccine trade tracker. I think an invaluable resource. I can say so because thankfully they didn't need me to work on it. We had real experts working on it. And this is a good example of the concrete collaboration between the IMF and the WTO. It's with a view to progressing this dialogue and to making sure that we have the best available information in front of us, but also the best ways of making that information work to support policy making, that we're delighted to have Ruchir with us today. And indeed, he'll be sharing with us his insights as a leading economist in this field, his perspective on the financial and trade lessons from the pandemic, and even better, offering ideas for the path forward. This is a good chance for me to once again acknowledge and thank our colleagues across the multilateral system, and particularly the IMF, the World Bank, the World Health Organization, for the spirit of collegiality, of collective purpose for public's well-being, and the very concrete, valuable results that have resulted. So, although he's very well known, I should briefly introduce Dr. Agarwal, who is, as I've mentioned, an economist at the IMF with a background in working on a range of policy issues, particularly in Asia, Europe, and the Middle East. And currently, as I've mentioned, is head of the IMF Global Health and Pandemic Response. His wide-ranging research interests are in the fields of macroeconomics, finance and innovation. He just mentioned a very interesting paper, which I have to catch up with, on the R&D lessons from the pandemic, which I think will be worth another discussion of this nature very soon. And he has the credentials of a PhD in economics from Harvard University. So with that brief introduction, I can't wait to hear what Ruchir has to offer. Over to you, sir.
Can you all hear me well? Yes, excellent. Tony, thank you for the very warm welcome, and actually to the WTO family for having me. I've just spent only the morning here so far, and I already feel truly part of the family system here. And this is exactly as Tony talked about, that multilateral collaboration that we've had. Let me start by just a quick disclaimer. Today, I'll be talking about a range of issues, and those views are not necessarily representative all of the IMF. Much of my conversation with you all today will be based on a new paper that's coming out with Geeta Gopinath with the same title, Finance and Trade, Lessons from the COVID-19 Pandemic. But I will also weave in other ideas from other pieces we've written, and I'll speak about them in due course. Let me, before we dive into the conversation, take a moment to appreciate the role WTO has played, both in their leadership during the pandemic and the great partnership through the Multilateral Leaders Task Force with the World Bank and WHO as well. In this respect, my highest appreciation and respect for the leadership, Dr. Ngozi, DDG Annabelle, Bob Koopman, and Josefita, Dayong, Tony, so many of us that worked really tirelessly throughout the last 12 months. And this has been, as Tony exactly said, a great example of how a multilateral system can work well together. And so that's one thing I wanted to start off with. And then let me just start quickly into the plan. My idea is to speak about 30 minutes, 25, 30 minutes at most, about a big few ideas, but we want to leave space for you all to engage with us, to have a lively conversation and an honest conversation. So please do put all your questions in the chat, because even though we are virtual, we want to make sure that this can be as interactive as possible. So let me start with those preliminaries. Basically, in the next 20, 30 minutes, what I would like to do is kind of give you an overview of where are we today in the pandemic, what have we learned during, let's say, the early lessons that we can draw from the pandemic, and then a few ideas, sketching a few ideas, which of course will become more firm as we go along, but initial ideas, let's say, on what the path forward could look like. So that's the agenda for the next few minutes. So let's start with where are we today in terms of the pandemic. There are three things. Let me start first with the key point. There is the economic and health costs from the pandemic. A lot of the problems we see in the world today, be it supply chain issues, inflation, part of it also stems from the fact that we are still in the grip of the pandemic. So our assessment back in January in our World Economic Outlook, we quantified the total global cost of the pandemic at that time to be about $13.8 trillion to 2024. And that, of course, adds to the much larger human cost in terms of lives lost, which estimates range from 16 to 20 million lives lost. So there has been a truly large cost of the pandemic for it, and which still stays with us. And there has been, what the Multilateral Leaders Task Force did about a year ago. We set out various targets for vaccination, treatments, and tests around the world. And if you look at where we are today, we're still fairly far from those targets. There's been insufficient progress. Over 100 countries are not on track to reach these vaccine targets. But similarly, there are large gaps that remain on the testing. There are large gaps that remain on the access to treatment. So and large inequalities between countries. So the three big takeaways I wanted to give you on where we are today is, first, as I've said so far already, the pandemic is still not over, and there are deep inequality in access to these tools persist. And there are countries that are still exposed to lockdowns, which basically means that a return to normality is still not there yet, at least across the whole world. Second, it is now clear that COVID is likely to be with us for the long term. So the virus is expected to circulate indefinitely and lead to periodic outbreaks and endemic outcomes. And third, there's a large uncertainty that about how the path of the virus can evolve further. There are various scenarios on how it could evolve from very mild scenarios to dangerous variant scenarios. And for this, I would like to refer you to a recent paper that has been written jointly with Geeta Gopinath, Jeremy Farrar, Richard Hatchett, and Peter Sands, where we basically lay out the path forward and how to handle the updated global strategy for COVID. So, but these are the three big points that we've made there in terms of the path of where we are today. And the policy implications and that work that we've laid out basically are the four big ones that with vaccines now no longer clearly being a silver bullet, for example, as it was in other diseases, we need to have vaccines are critical, but we need to have a comprehensive toolkit for each country. That includes tests, that includes treatments, the oral antivirals. And second, we need to make sure that this toolkit is evolved, dynamically updated, and we stay 2 steps ahead of the virus as the virus evolves. So that's kind of a way to kind of mitigate the potential losses, future health and economic losses from the virus, especially given the large uncertainties around how it will evolve. Third is, now it's over 2 years, we've been in an emergency response mode. It is time to, start thinking about, again, a lot of priorities, health, social, and other priorities that were put on hold for this period. So to transition to a sustained response that's balanced and pays attention to all these other priorities. And this will very much require, with the multilateral support that we've talked about, but require a bigger focus to embed this transition into the country plans and the country national authorities' perspective on what those priorities are, because it will differ country by country. And the fourth thing, and I've bolded that because that's kind of a good segue into the second part of the talk, is we've emphasized there was there's a need for a unified risk mitigation approach to future infectious diseases. By this, I mean what we're trying to say there is the pandemics are not simply a issue that affects one country, but it's a global systemic risk issue. So fighting pandemics is about securing global economic security, global health security, global trade security. And so it's really important to develop a unified approach that leverages the power of the multilateral system to mitigate these risks, mitigate these systemic risks, and secures resilience and security going forward. And I'm going to elaborate more on what that means towards the end of the talk. So that's kind of the first section of what I wanted to do is where are we today before even trying to draw some of the early lessons. So let me turn to the early lessons that we've learned. Here I'm going to focus on 7. We're going to go through them relatively quickly. So we're just going to give you some high level ideas and then we'll refer you to the paper to get more details on that. So effectively, once a pandemic begins, the global challenge is to innovate and develop new life-saving tools to fight the new pathogen, to produce these tools at large quantities and quickly enough. And third is to basically ensure equitable access to these tools to all citizens of the world, independent of where they live. Given the global public good nature of fighting pandemics, these steps require strong multilateral coordination and financing. In a way, that was the idea behind why the leaders of the 4 institutions, IMF, WTO, WHO, and World Bank, why we came together to create the Multilateral Leaders Task Force, is recognizing that global public good nature and that need for coordination. What we did learn and what we did see, however, was during COVID, the world has faced significant challenges along each of the steps, especially around step 2 and 3. And in a way, those are the lessons that I will be focusing on in the remaining few minutes of this section. So just that was just a stage setting Let's talk about lesson one. First four will be on financing. The last three will be more on the trade side. First lesson on the financing is, as I've already alluded to earlier, is pandemics are a systemic risk issue, not solely a development issue. And therefore, donors must put in place sizable financing in grant form. Dr. Ngozi has said that pandemic policy is trade policy. Our managing director has said pandemic policy is economic policy. The idea here is quite simple. Until there is a durable end to the health crisis, there cannot be an end to the economic crisis, to the trade crisis. And in many ways, this brings a rationale for fighting pandemics that's very different than the humanitarian or development rationale for humanitarian development assistance. We've, I've heard some people describe how countries responded to the pandemic as there's finite amount of food on our table, so can I feed my family first before feeding someone else? That logic does not apply to pandemics, because if we don't share with our neighbors, it also reduces the food available on our own table. And that's the idea when folks like the leaders of the multilateral leaders task force have said, no one is safe until everyone is safe. And so that rationale requires a very different type of logic for global finance. International community needs to put in place more funding to fight in grant form to fight pandemics that goes beyond the existing official development assistance. And in fact, here, since I'm at the WTO, I should also recognize the work of Dr. Ngozi as part of the high-level independent panel for the G20, which he wrote with Senior Minister Taman and Larry Summers. And so in that work, they've also kind of effectively emphasized that global public good role. And so clearly we are not there yet. There's a lot more thinking needs to be done. This requires both a shift in thinking on the political, operational, and economic level. And so this is something that we think should be more focused on going forward. Lesson two is on the timing of financing. So the time value of action is enormous during pandemics. Even accessing resources 1 week earlier translates into lives saved. It translates into a better economic outcomes. And so it's really important now, from our perspective, to think about how can financing be made available upfront, what we've called day zero financing. And from our one thought experiment here is COVAX raised about $10 billion by June of 2021. It took them about 15 months since the start of the pandemic to raise that funding to cover about 30% of the populations in low and middle income countries. If donors had made that same amount of funding available 1 year earlier, it would have been practically costless, given the interest rates, for the donors to have done that. But the world would have been in a very different place. The access to resources would have been much more equitable. And we've done some work. This is new work that's also forthcoming with a colleague at the World Bank, Tristan Reed, where we look at the timing of contracts and the timing of delivery of vaccines. And we find that 60 to 75% of the variation in when the contracts delivered can be explained by when contracts were made. So having financing available upfront for developing countries to be able to get secure a place in queue for them is likely to be essential. And without such financing, there can be large delays in access to tools, and which we are already learning from the COVID pandemic can leave long-lasting scars. And just I want to make this point really salient for people, especially those who have kids, is, if you look at school closures, right? That's one example of what delayed access to resources can do. So if you look at school closures around the world, this map shows you basically the total duration of full school closures in weeks. Is from a blog that I wrote a couple of months ago, and basically the blue areas are 0 to 5, and the light blue is 5 to 10 weeks, where the dark red is 40+ weeks of full school closures, based on the data set from UNESCO. And effectively, you see is countries, especially developing countries, where access to vaccines were delayed, are also places where there's large social impact, such as through school closures. And if you know that the population of young population in developing countries is roughly twice as much as in advanced countries, and school closures were roughly twice as long, that adds up to there's a quadrupling of the effect and these effects, these scars from the pandemic will be carried by our young generations for decades into the future through the impact on learning losses. So we can do better next time, and part of doing better will involve getting access to resources through early financing for developing countries. So that's lesson 2. Lesson 3 and 4, quickly to speed up a little bit, is on the scope of financing. Part of the problem is that what's happened in the COVID pandemic is the world started to solve the R&D problem first in 2020, then try to solve the production problem in 2021, and now in 2022 is trying to solve the delivery problem, in-country delivery. The more we can work on that delivery side, on the demand side, on day 0, at the same time, we should be working on the R&D and manufacturing. The more we can make sure that there's a better and comprehensive, effective response. And so the scope of financing should not be only on the supply of tools side, but also on the demand of tools. And that requires investments even early on in strengthening health systems. On the financing frameworks, and this is really a WTO point as well, is there is a lot of fragility in the system when the system is under stress. There are a lot of downside risks that can materialize and almost inevitably materializes. So the more the financing frameworks take that into account, give space for failure, give space for folks to take risks on the innovation side, the more we'll be able to have a chance to handle even the bad scenarios. We should not just work on the baseline scenario when we're trying to financing tools, especially in an emergency response, but already incorporate financing for the downside risk. And the more we can do this in a complementary way going forward, not now in a way the conversations are there are 3 parallel conversations in global health. There's a conversation on what should be done on COVID. There's a conversation on what should be done for future pandemics, what some people call disease X, and another conversation on what should be done on the universal health agenda. The more we can unify these conversations and have a single financing framework while taking into account the downside risk, the better we will be able to handle both before and after the pandemic materializes. On now, moving from the finance towards the more trade side of the lessons 5, 6, and 7. 5 is really an R&D point, and this Tony has mentioned the paper earlier on the lessons from COVID-19 R&D. This is based on a work jointly with Patrick Golay at the University of Bristol. And what we do there is we looked at all the clinical trials around the world and immediately before and after COVID started. And at some point, about 40% of all the trials in the world that were started were COVID trials. And in a way, when you look at the market size of COVID and compared to how much the R&D response was, we estimate that it was about 5 to 25 times bigger than what its market size would suggest. So the role of public sector funding was important. The goodness, the non-monetary incentives of scientists and even the industry participants of doing their part for the world was important. The more we can learn from that lesson, and the more we can try to use those benefits design the innovation system, the incentive system to deliver R&D going forward for the other challenges that we face, the better we will be able to handle not just future pandemics, but more broader challenges facing humanity. So this will require greater public support. And really, I invite those listening and those at the WTO and others to really start thinking, really, how could we do that? Perhaps I can say one more footnote on this, which is there is a debate in economics on, are good ideas getting harder to find? There's a debate on, is science really slow moving, or can science move really fast? As the conversation in the future, years and decades will shift to what drives long run growth, the role of innovation, the role of R&D will become more central. And the more we can learn from this episode of how the world reacted and draw the lessons from that and apply it to designing the innovation landscape going forward, the more we can support long run growth. And to me, this is actually one of the points of optimism. There are many reasons not to be optimistic about the world, but this is one good reason to be optimistic, is there was global cooperation. There was a fast, effective response. Of course, it was not perfect. There was a lot of trials that did not end up going anywhere, but there are a lot of lessons to be learned there. Let me move on to point number 6, which is on production. And this is truly, core here at the WTO, is global supply chains can be subject to significant bottlenecks and fragility when supply is scarce but demand is high. Think about what happened in 2021 in the vaccine world. The vaccine manufacturers produced roughly 3 times the annual global supply of vaccine in a typical year. And that's enormous. I mean, that's probably nobody would have predicted that the world would be able to do that. But we did that. But of course, such rapid scaling up came with several supply chain challenges. Very, very established companies with decades of experience also faced trouble. So there was shortage of raw materials across multiple vaccine candidates. There were quality control problems that substantially delayed access to vaccines in several countries. So a key lesson, and I think this is a much broader point about trade going forward, is there are systemic supply chain risks that we need to start studying, understanding, monitoring, and addressing. And from a contracting perspective, that contracting authorities should work on diversifying their portfolio. And that diversification involves countries, companies, platforms, technologies. So the more, in a way, we can have a world, a trading system that's integrated, the more resilient we can be to these systemic supply chain risks. And I believe this is going to be an area where probably there's going to be a lot of innovation in the trade policy world in the next 10 years, just from my humble perspective. Of course, I speak under the control of my WTO colleagues who've taught a lot more about this. But from my humble perspective, thinking much more carefully and about where those bottlenecks will be, from food supply chains to critical raw materials to essential products like vaccines, and designing a system that's more resilient will be a central policy challenge going forward. So, and we can learn a lot of lessons from how we manage it during COVID. Lastly, on the cross-border flows, we have to recognize the reality of the political economy we face. We have to recognize that it's easy for folks to criticize governments, but we have to recognize the constraints governments operate under. We have to recognize how hard it is to balance value lives of folks in your own country and other countries. And in a way, what all of that, when you aggregate it up, effectively what COVID showed us means that free flow of goods and materials cross-border is hard to maintain. It's really hard to maintain. And the Multilateral Leaders Task Force, a big part of our focus was advocating, pushing, nudging what we could do to make sure those free flow of goods can activate. But it is, we had to operate under the reality of the political economy that constraints. And so in a way, the new thinking, what this has spurred, and this applies not just to vaccines, but broader, is can we regionalize supply chains? Can we regionalize domestic manufacturing capacity? And that's a big question. But as funding will be scarce, the pendulum could also swing too far, where there could be overinvestment, and there are worries about sustainability or creating white elephants, so here again, I believe institutions like the WTO and other multilateral institutions can play an important role in guiding and bringing the world together in ensuring sustainable investments, in cooperative outcomes, where knowledge transfer is happening across borders, where cooperation is happening across borders. This will require movement of people. It will require talent, training. It will require a novel economic thinking, because some of these investments will not pay off until there's an outbreak or an epidemic or a pandemic. So it may be the case that the rate of return in normal times is not very high or below a profitable threshold, but what should be the rate of return that we should accept below the break-even rate to manage, to benefit in these downtime? So I think that the role of thinking and guiding these investments from an insurance perspective, and taking the fiscal implications of such investments. And so there is a role, there is going to be a lot of scope of thinking, and I'm just scratching the surface here on what the big ideas, where it can go on this day. So let me say one more thing on that trade, and as Tony mentioned, which is the WTO IMF trade tracker. This is a wonderful collaboration, and my highest respect and appreciation for WTO colleagues for the work on this. In many, many ways, an answer across a lot of the policy challenges I've talked about is evidence, is data. The more we can work together to bring an evidence, data-driven perspective, the more we can inform policy, not from a political basis, but informed from an evidence perspective. It is incumbent upon us in the multilateral system to make the case for why collaboration is good for all. And we cannot do that without more transparency, more data, and thinking about problems in ways we are not, because we've not been basically able to measure things. So, and in a way, a lot of these angle issues that came up on the trade basically side, we learned through this joint collaboration. I wanted to plug that in, and please go to our website on this to learn more about that. Now, let me quickly, in the last few minutes of my initial remarks, talk about path forward. Here, I just have 3 more slides. Just bear with me. I've talked about these 7 lessons, but beyond these 7 lessons, there's a broader lesson. The broader lesson is the critical importance of collaboration and the need for better stewardship of global public goods. If you think about, when our institutions were created at its inception, the challenges we face are very different than the challenges the world was facing when our institutions were created. So given the challenges now are much more cross-border, are much more common, it requires a very different level of cooperation. And to be able to fight those challenges that our species will face, we need a stronger multilateral system. Of course, there are many events that may push against that. And to me, that just increases the value of the quality of work we do. it increases the value of the relationships we build, and it increases the value of how we can listen better to our membership and find solutions that maybe we've not seen before. So there is a much more emphasis on imagination than, in my view, in my humble view, I can say, than ever before. We need more imagination, and we need to find those secret formula to cooperate that, where we've not found those formula before. And in terms of, that's my first point on what it will require. Second is on the equitable ownership. I am a public servant of the multilateral world, but I was born in India, and one thing I've traveled a lot across what people call the global South. And one of the things that is happening is folks are talking more and more about the equity. This was a key topic of discussion from the Multilateral Leaders Task Force: equitable access, equitable access. And what the spirit that the COVID has shown is, how can we make sure that the system, the multilateral system, delivers equitably for all and works for all? And going back to the point on imagination, part of our role is to find ways that does not go, as Tony just before we started talked about a zero-sum game. We need to really work hard and find solutions which goes beyond zero-sum. Now, of course, all I'm saying sounds abstract, but there are concrete ways this can be done. There are concrete ways where we can find solutions. And one good example of this from the pandemic, and again, I want to credit the Multilateral Leaders Task Force for that, is the idea of queue swapping on vaccines. And we basically developed and pushed for countries that were ahead of line in the queue for getting a vaccine delivery, but they had already vaccinated got high coverage of the domestic populations. Can they swap their place in the line with developing countries, with COVAX, with the African Union? And that is just an idea of trade, which basically showed there could be gains from trade. So the more we can come up with those type of ideas, the more we can work together. I think that's where that stewardship and have joint ownership of all of the global public goods. And I've talked a lot about the rapid and adequate financing windows, so not going to say much more there, and also the diversified supply chain. So let me end with 4 long-term trends that I see as an economist, and this is kind of where I'm being more speculative and maybe perhaps a bit provocative, as I was instructed that, try to come up with ideas that you can share with our membership, which is the WTO, that, from a longer term perspective. So I just want to give you 4 ideas that I see from my tiny window of the world. So one is, now there's, of course, a big question is, has trade peaked? Has global trade peaked? And a practical implication of that is, there are areas where, China, of course, is a very big trading center in the world, but there are industries which China is exiting as it grows richer. Now, a question is, where will those jobs go? Can those jobs go to will those jobs go to a small set of countries, for example, as it's going now in Vietnam, Cambodia, and Southeast Asia? Or can those jobs go to a broader set of countries across sub-Saharan Africa, across the global South, where we can get more high-quality export-driven jobs? This is a central question facing us as the global trading architecture reorganizes with China's evolution into a higher value-added trade. And it is central to the issue of income, cross-country income convergence. So here I have just a chart for you where maybe hard to reach. Let me just walk you through. On the left panel is basically, on the x-axis is income, or in log terms, of a country in 1960. And on the y-axis is basically how much that growth has been in that country. And ideally, you would have all the economic prediction is all of these countries should be on one line with a downward slope. So over time, the poorer countries grow faster and they converge to richer countries, so everyone's income converges. But what you see are these convergence clubs that have emerged, which has persisted, right? Panel shows even in the last 2 decades. And what is needed for those countries that are you see the red groups, which are African countries, Latin American countries, and some of the Asian countries, to move up in the average growth. And if you look at the trade intensity, so we're doing some work with co-authors Eliana Carranza and Alex Domash, which is new work we're doing, is the trade intensity is a big part of this cross-country convergence, where a lot of the countries that are in the lower growth world club are also not managing to increase its trade intensity. So for the same level of income, when other countries, for example, if you look at countries in Asia, the African countries, when they reach the same level of income, their trade intensity is much lower. And I think this is a fundamental question, and goes back to the classic issue is globalization leaving people behind? And the modern day interpretation of that is, in a way, how can we have the high quality jobs integrated into the global trading system, going to all countries, not just a few. So that's one. And 2, 3, and 4, so this is my last slide really, is about, one thing that we are seeing is, yes, trade barriers have gone up some, non-trade barriers and some tariffs. But what at the same time has happened, fear of future trade barriers have gone up. A lot of the decisions being made today at the business level, at the country level, are on the supply chains are being driven by fear. And this applies to the medical space, the COVID-19 toolkit space that I've talked about. So in a way, the world can evolve in one of two ways in response to this fear. If suppose I'm sitting in country 1 and have a fear that other countries will block access in the future to certain supply chains, a fear response for me is, even if there's free flow of goods today, could be to say, I want to create a domestic supply chain for those goods. If all countries then start thinking this way, that's a major shift into the global trading system without actually seeing any change in trade barriers. Just the fear itself can have a large lasting impact. Alternate world is, if you have that fear, I diversify my supply chain. Instead of relying on one country, I rely on 4 other countries and have goods coming from multiple countries. That's a good scenario. And there we become more interdependent and more resilient, not because of self-reliance, but because of a diversified global supply chain. Now, which of those 2 worlds will materialize is very much a function of the decisions and the landscape that we will operate in. And as from, again, my humble perspective, I do believe WTO colleagues can play a big role in guiding us to that better equilibrium. And this should be, as I see this fear, the role of fear in supply chains may become a bigger issue, not just on vaccines, but food, on semiconductors. This can apply broadly. And that applies to point number 3, which I've talked a lot about, which is systemic supply chain risks. I do believe that we need a system, and we've laid out in the first paper that we wrote with Geeta Gopinath on the IMF pandemic proposal, we've laid out a way to think about systemic monitoring of systemic supply chain risks on from a pandemic perspective. But that framework applies everywhere. Where are supply chains bottlenecks that can emerge on essential goods that can destabilize the global trading system? The more we monitor, the more we quantify, and the more we can collectively address, the more resilient trading system we can have. And I think COVID just gives us a nice lens to think about it. And we should use this opportunity to make more progress on building that resilient trading system. And the 4th thing I've talked a lot already about is the scaling up of global R&D. As people move from, as the price of goods go down globally, as income levels will go up, there will be a move towards more and more focus on long-term innovation. And I believe WTO has a role to play here with the other multilateral institutions. How can we design a system where we can scale up R&D sustainably, collaboratively, to face the problems facing humanity? And one really interesting thing for me there is we are often able to cooperate much better in inventing new things than to cooperate to share what we've already created. So the more we can focus on having that healthy trading system of ideas, Tony has done a lot of work on it, and WTO colleagues, the more we may design a better future for ourselves. So let me stop here and take any questions you may have. Thank you.
Thank you very much, Ruchir, for a very insightful presentation. We are very happy to have you here with us after 12 months of working together remotely. We have some very good questions from our audience. And for example, a question from our colleague Roger regarding the large gaps in testing. This inequity is indeed confirmed by various databases. So he would like to know if you have any insights regarding the reasons for testing gaps. For example, insufficient manufacturing capacities, affordability, lack of infrastructure, including the laboratory facilities, trained health workers, etc. Thank you. Another question is regarding the need for sustainable business models. For example, having manufacturing capacities ready that can be quickly activated in health crisis. But the details for such models, including financing, are missing. Who should be the driving force to develop such models? And would this require the involvement of all stakeholders, but based on which ideas and experiences and in what setting?
Okay, so the second question is, okay, we understand that sustainable business models matter, but practically how do we get there? Right, okay, gotcha. Okay, so first to Roger's question, yes, the developing countries are testing about 80 times lower than advanced countries. And this matters because if we don't detect the virus early on for ourselves, we don't get the proper treatment in time, but also it matters because we may not catch new variants that are emerging in time. So that's kind of and the gaps indeed are very large. What are the cause of the gaps? One thing is, if you look at the ACT Accelerator fundraising, they've raised about 20 billion plus so far, and about 70% of that has been for the vaccine pillar. So the world has financed vaccines. Now there's an oversupply of vaccines, but there's not been enough sufficient funding, I would say, for the testing and the treatments pillar. So financing has been an issue, one. Two is investment in health systems. This, is not sufficient to just buy the tests and hand it out. You also need a system in place to actually have the testing done, training, labs, etc. And so many developing countries entered the crisis, pandemic, without as strong a health system as would be. So we also need more investments on that side. And the third thing is, my worry here, I just want to highlight, is now the world has access to oral antivirals that are highly effective in preventing hospitalization and deaths. But those require administration early on to be effective, and that requires testing. So we need a test for treat strategy. So it's really important going forward to work on this testing gap and to work on that test for treat strategy, because this will enable all countries in the world to basically return to normal without the fear of surges, without the fear that if I step out of my home, I'm going to get into a hospital because of the big risk and not having access to the testing and treatment. On the second question on sustainable business models, this truly is a very, very, you're right. I was very much high level, very much surface. So I don't know exactly who the person is who asked the question, but you're totally right. I think the issue is it's really politically complex and business-wise complex. And why I mean there is what the pandemic led to is many initiatives to regionalize supply chains. It is true now, however, that many of these capacity that was expanded because of the large oversupply of vaccines will no longer, at least in the very near term, be needed. So there's a risk that the pendulum may swing again back too fast. And so it's really important that this is guided by a few principles. One is there is a need for that these facilities can produce routine, for example, vaccines, you can supply routine immunization. Second, there is so that's when people talk about sustainability. And the second thing is if you have a facility in the south, who are you supplying? Are you supplying to other countries in the global south? Can you be supplying to the rich countries? Can you supply to COVAX, for example? So these are questions that need to be answered. At the end of the day, the reason why many of these investments have not taken place is because it's not privately optimal. So what we also need to work on is exactly the question you're asking, is who should be the driving force? In a way, the governments have to work with industry closely and figure out kind of what is the acceptable and optimal subsidy from an insurance perspective to run this in a way that is sustainable without creating distortions in the system. And last thing I would say there is another risk there is to have too many parallel initiatives. And if you have, at the end of the day, if everyone wants to do that, you will get massive oversupply in the aggregate. So the another driving force here is of the multilateral institutions, including the WHO colleagues, WTO colleagues, World Bank colleagues, is to ensure there's coordination in creating this supply at the aggregate level. I hope that gives a bit more granularity, although I recognize that it's not as granular as you may like me to be on that question.
Thank you very much, Ruchir. A lot of food for thought. We have a question here regarding unified finance frameworks to keep it in the same line we're covering. For example, you mentioned universal health coverage, COVID-19, etc., as a necessary ingredient for sustainable local production of vaccines and related products and infrastructure in developing countries. So what is your view around this? Another question is, it says, you have listed out all that needs to be done in supplying global public goods. One missing link is which global institution should be in charge and how such an entity should be governed when faced with another deadly pandemic. And another one, just as citizens in countries have experienced pandemic fatigue, which has affected their willingness to comply with restrictions over the duration of the pandemic, there is a concern that organizations and companies might experience a similar fatigue. What can be done within organizations and companies to help ensure that the lessons learned can be put to good use? Right. Thank you.
I think I made a mistake by asking to you all to be tough, because some of these are tough. Especially one of them is tough. So, but let me try my best. First, on the financing frameworks, I do think effectively think about it. I was thinking about it from a perspective of the donors. Yes. What's happening is global health agencies are going to donors with multiple asks. First, there's an ask of what needs to be done on COVID. Second, there is an ask on what needs to be done to fight future pandemics. And third, there's a usual ask of what needs to be done to fight HIV, TB, malaria, all the other diseases that affect us. Now, let's think about what does it mean to invest in pandemic preparedness. at the end of the day, part of it is strengthening health systems. But is it also not strengthening health systems for the other agenda? So in a world where global attention is shifting to other challenges, when financing is becoming scarce, our point is, can we have a more unified financing framework with an aim of moving towards a singular ask, which benefits from the complementarities across the different pillars? This may allow us to reduce the financing need. You don't need to duplicate the financing cost. It may allow us to truly prioritize. And I guess as an economist, one thing I learned from the working on global health, maybe as an outsider, is the importance of emphasizing the budget constraint. The budget constraint is real. And in global health, because the global health colleagues deal with people's lives, everything seems important, and it is important. But then what work we can all do collectively is, by trying to unify that financing framework, is help prioritize within the priorities, prioritize the priorities. And that's what I mean by when I lay out the vision of a unified financing framework. I hope that answers. We have more in our paper, the one with Geeta Gopinath, Jeremy Farrar, Richard Hatchett, and Peter Sands on this. So please, I refer you to that. On the second question, which institution? This is a lovely, lovely question. So the way I think about it is the following. Our ancestors gave us certain rules and certain customs that we work in. And in a way, the multilateral system is one of the gifts from our ancestors. But they did not envision all the problems that the world will face. Now we are left with the existing institutions that we have, and around a variety of issues because of the pandemic, as it's shown, and also the subsequent war, cooperation may be harder. It is incumbent upon us to be more imaginative and work as best as possible to do whatever we were doing before, but also rise up to the challenge of global public goods within our narrow mandate, while staying within our mandate. So for some of us, this may not be possible because our mandate does not allow it. Now, that may leave large areas open where in the global public good space where no existing multilateral institutions can answer. But by connecting exactly like things we've done with the Multilateral Leaders Task Force, you can start to perhaps close down that space. Still, there will be areas which we cannot tackle. And as I was thinking about this in the past few months, I do think there is more role for the industry, for academia to play. What I've found really fascinating is not only the conversation we're having now. I am an IMF employee sitting in the WTO, which is incredibly interesting for me that this kind of things are happening, but also the incredible conversations we've had with CSOs, with academics, with the industry. And if there are ways, and so what the Multilateral Leaders Task Force has done is they've developed, and WTO has taken a big lead in this, is developed a vaccine network, which brings together the CEOs of vaccine manufacturers for COVID vaccines with the heads of the Multilateral Leaders Task Force. So the more we can find ways to collaborate in new ways with new people who we would never talk to before, the more we can close that gap. So that's how it may not be the most optimistic answer, but it may be a little bit more of a pragmatic answer. And the last question was on the pandemic fatigue. I also really like this because it is tough. I mean, it is tough to deal with these issues year on. And while also, as I said in my talk, while we've put on hold many of the issues, priorities for the world. So first point is, I think we should be very pragmatic. And if COVID, which is no longer the #1 source of death in many countries, we have to transition from just talking about pandemic to the other problems. And we have to be led and guided by our member states our membership on how those priorities shift. We cannot just because we've worked on COVID and we collaborate on COVID, stay there. So that's point one. But point two is, I do think, in a way, working in the multilateral system can be quite depressing at times, because the solution exists, but getting to the solution is hard. I was really interested in how Tony said, why DDG Annabelle cannot be here, because she's engaged in intensive trade negotiations. And these are intensive because it's really hard to come to the solution. But what the pandemic has taught me, at least personally, is the importance of emphasizing the role that we all can play in moving the needle at the global stage. So the more we can restore that faith in the multilateral system and work together, it can be an antidote to some of that depression and fatigue. And maybe that's not the full answer that you're looking for, but maybe that's an initial answer, at least, on that.
Thank you very much, Ruchir, especially for those last few very insightful and personal notes. I think it's highly appreciated by all of us who are working to find a balanced response to the pandemic. With this, I would like to thank everyone for joining us here today. I would like to thank also colleagues who will watch this video later on. We hope that you found this presentation interesting, and please do contact us if you do have any further comments or questions or suggestions of topics that we might address in the future. Thank you so much.